Deputy Programs Manager with the expanded program on immunization with the Ghana Health Service. Doc, good morning to you. Thank you so much for joining us on the program.
Good morning, and thank you for having me.
How are you doing this morning?
By God's grace, doing well. And
it's a very wet, windy, and rainy one indeed. I'm doing all right.
Great.
Okay, so we're talking about a COVID-19 and its resurgence, if you will, or is resurgence not the right word? Has it, in fact, been with us throughout, or with the ups and downs we've seen, did we have a bit of a break? Paint a picture for us, please, Doc.
Okay, so thank you very much, and good morning to all our listeners. This morning is a privilege to be with the team to share something on vaccination or immunization in Ghana. So as you rightly indicated, the COVID-19 pandemic struck us somewhere in 2020. We started responding. The numbers were actually on the surge, but with various interventions, including the vaccination that we were delivering, the numbers of persons that were coming down with the disease started going down. And so a couple of months ago, somewhere in 2023, mid-2023, the initial lockdowns and the restrictions that were placed on us due to the increase in the number of cases actually was lifted. And so we were virtually returning back to normal. But in terms of the numbers that were coming down, it wasn't to see that actually the disease was over. In terms of the numbers that we were recording, it had actually significantly come down. But in recent times again, we are seeing quite a number of the cases in our various health facilities, which is really a concern for us, but because we would not like to go back to those days when the
Is there a possibility, Doc, of us going back to those days?
Yes, there is that possibility, because nobody can actually predict the nature of the virus. Depending on how the virus continue to mutate or change its form, that determines how the infectivity or how it infects persons, causing deaths or causing hospitalization and others. So what we encourage and advise is that generally we should always be up to date with our immunization status, so that no matter how it changes or mutates, we are always good in terms of our protection against the disease. So that is generally what.
So for this particular resurgence, the way to stay safe, you say, is to take the vaccine. Right. So for example, when COVID-19 was at its peak, I took a vaccine, let's say, I think it would have been maybe October 2020 and maybe a booster in 2021. Has that all expired, if you will? Do I need a top-up? Because, people will be asking, if I've already been vaccinated, why do I need to revaccinate or to top up?
Okay, so that's correct. For those that received their vaccines in, I'll say, more than a year, they got fully protected or fully vaccinated with their vaccination status, then they will need periodic boosters to ensure that their immunity status remains at maximum level for them to continuously be protected. So, for instance, we are now in the month of May.
That's right.
If I received my last booster or my primary series or that particular dose that will confer on me maximum protection last year, May, then I'm again due for a booster within the general population. But for our healthcare workers, the elderly and the aged, our policy actually recommends that because they are at the forefront of taking care of the sick ones with the disease and others, and they are at risk of actually coming down with the disease, then their booster is supposed to be from 6 months up to 12 months. So for them, it's a bit shorter because of that, they are at risk status. Otherwise, with the general population, then we recommend that for every year you go for the booster. And that is basically because of the nature of the vaccine that we have currently, that when you get the maximum protection or the immunity, with time, the immunity tends to go down.
Right.
And so to ensure that you stay up to current levels that we expect that each and every person should have, then we recommend that the yellow booster each and everyone goes for it.
What about those with pre-existing medical conditions? Should they also be taking the vaccines at a shorter interval, or can they go along with the general population and do a yearly vaccine shot?
Yeah, so they are also part of those that we consider at most risk. So
Right.
they also go with the 6-month duration. They are supposed to then go for their boosters too as well.
Okay, so you say that COVID-19 is still wreaking havoc as we speak because the numbers are going up, and it's still the case that people are dying from COVID-19 complications.
Yes, those that we are recording in the facilities, in terms of death, we have not actually seen it yet, but in terms of the numbers that are testing positive, we are seeing increase in those numbers. Then in terms of severity, not as we were seeing it before.
Okay.
But we do not want to relax on our effort and start seeing cases that they are ending up in the ICUs and others. When we are fully protected, then no matter how the vaccine will mutate, the WHO recommendation has actually stated clearly that our vaccines still remain potent to protect us against the havoc that these viruses may actually inflict on us. So we are encouraging the population. Let's ensure that we remain up to date with our vaccination status. Fortunately, as we speak currently, the Ghana Health Service is rolling out a national COVID-19 vaccination campaign.
Right.
And this is our 10th round that we actually conducting across the 16 regions and 261 districts. So let's make ourselves available to receive these vaccines. It remains the surest way to ensure that we are able to defeat the COVID-19 disease. In addition to the other interventions that are always encouraged, the hand washing, the use of the sanitizers, we still encourage them.
What about even the nose mask wearing? Is that something that you are still encouraging for maybe the more vulnerable amongst us?
Yes, you can wear them. But most importantly, ensure that your vaccination status is up to date.
Okay.
When you wear it, it serves as an additional, if you like, protection for you. And for some of these flus, viruses that are around. You see, during the peak of even the COVID, we noticed that the rate at which persons were coming down with other flus or influenza disease actually was on the decrease. Why? Because additional intervention barriers or interventions, we've added it to our system. And so we were protecting ourselves against other diseases inadvertently. For instance, issue about cholera was actually something that during the peak of the pandemic we were
That's
not
right. We were really washing our hands.
Washing hands. Yeah. Whenever you are entering offices, public places.
We were cleaning our door handles, everything
was in place. But because the cases were coming down, we started getting complacent and others. But we are encouraging ourselves that let's go back to those interventions and ensure that our immunization status is up to date. And then we will be good.
Absolutely. Well, time check, it is some 14 minutes to the top of the hour, 10 a.m. You're still live here on 3FM Sunrise on 3FM 92.7. You know, we like to talk health on Mondays. Dr. Naziru Tank is here speaking to us about COVID-19 immunization. He says the numbers are going up and it's incumbent on us to make sure we're taking care of ourselves and go back to some of the hygiene practices that were quite high at the time that COVID-19 was amongst us. In fact, I shouldn't say it was, because as Doc has told us, the numbers are going up. It is still very much with us. But Doc, as we round up on this conversation, what are your projections for the trajectory of COVID-19 in our communities? And you've mentioned immunization and hand washing. What else would you say to all of us? We have what I call pandemic fatigue. We're tired of hearing about COVID-19. Give us some advice.
Yes, so I'll encourage and recommend that each and every person ensure that with these interventions that the Ghana Health Service has put in place in terms of ensuring that the COVID vaccines are available to us at our various health facilities, we are bringing it to your doorsteps at your various workplaces. Let's make ourselves available. We are saying that generally if you are already fully vaccinated, you need the yearly boosters. And if you are within the category that we put at high risk or the highest risk, ensure that within every 6 months you go for the vaccine. That is our surest bet for now, because we are unable to actually determine or predict the nature of the virus as we speak. Today, we have it under control. As soon as it mutates and something else happens, if we are not fully protected, then you remain vulnerable to the attack of the virus. So let's make ourselves available as we get this campaign ongoing. And then even subsequently, the vaccines are still available for whatever reason you are unable to get the vaccine within this period. That is from the 5th that we started yesterday. We are ending on the 9th. The vaccines will still be available at our various health centers, clinics, and hospitals so that you can walk in at any of the weighing centers and then get your vaccination given to you.
So it's a very simple one. Walk in, get vaccinated, and get some much needed protection against COVID-19. Doc, thank you so much for your time this morning and for shedding some light on COVID-19. We're tired of hearing about COVID-19, but if it's still with us, then we certainly have to stay protected.
Sure.
We're grateful.
Thank you for having me.
Thank you so much.
Coronavirus, COVID-19.